Hi, everyone. So here we are today going to talk about the fundamental principles of the nervous system. But in part one, you already got the fundamental principles of the nervous system, the brain, the neurotransmitters, how the brain communicates. And then in part two, we talked about antidepressants and antipsychotics, types of drugs that affect the chemistry in the brain, right? And so, what I want you to recognize is for antidepressants and antipsychotics, most of them have a mechanism of action by affecting different neurotransmitters. Okay. So, in part three, we're going to learn about antiepileptics. Antiepileptics is a whole different type of drug that affects the brain, but this time, most of them act by affecting the way that the brain communicates through electrical stimuli. Okay, so remember, two ways in which the brain communicates. First of all, right, let's remember that the brain's main purpose is to communicate. And it does that through two different ways. One, first electrical signals, and that occurs within the neurons themselves. Then second, the brain also communicates through those passing of the neurotransmitters or a chemical signal. Okay, that happens from one neuron to the next. Okay, so when we talk about antiepileptics, and we'll start first at what is the disease epilepsy, and what are seizures, and then we'll go into the mechanism of different antiepileptics. When we talk about antiepileptics, I want you to think back to how the brain communicates, and maybe even go back to that first topic and really look at and hone in on the electrical communication within each of the different neurons. So epilepsy is a brain disorder, a chronic brain disorder that's characterized by recurrent seizures. So seizures that occur over and over and over again. And the seizures result from an imbalance in the excitation and inhibition in the brain. So the brain is basically overactivated mainly through electrical stimuli and not being allowed to recover or to come to a steady state with minimal communication. Okay. So a seizure by definition is a sudden temporary disturbance of the brain electrical activity. So in this picture, we see here that down the axon, we see these little flashes of light that are moving from the cell body down to the axon terminal. And those are our electrical stimuli or electrical impulses. Okay. So these electrical impulses during a seizure are uncontrollable, and there's a burst or an excessive amount of brain activity occurring all at one time. Sometimes this can be all over the brain, that would be your generalized seizure, or more localized, and that would be your partial or focal seizure. Okay. During this time, normal brain communication is halted. Outward symptoms of a seizure and epilepsy include involuntary movements, loss of consciousness, and changes in behavior or perception. So what actually causes an epileptic seizure? So an epileptic seizure obviously is a brain disorder. It occurs when the cells of the brain are provoked to be overstimulated. Okay. And what can cause that? Well, that can be caused by a lot of different things. It can be caused genetically, family history. Okay. It can be caused by an infection such as meningitis, which affects the brain and the central nervous system. It can actually be caused by pregnancy. In rare cases, it can be caused by traumatic brain injuries. Okay, so lots of different causes for seizures, especially epileptic seizures. Probably the biggest one is traumatic brain injuries and family history or genetics. So let's take a brief look at a historical overview of the treatments for seizures. We call these seizure treatments anti-epileptic drugs, or AEDs. So in the mid 1800s, so 1850-ish about, was the first treatment for seizures. This was using bromides to help treat seizures. About a half a century later, other PHB-like drugs, so similar to bromides, were used and developed. The most prominent one is phenobarbital. So phenobarbital is a drug that was previously used prior to 1910 to induce sleep. But because it had a calming activity for the brain, people tried it on seizures, and it actually worked. It also had an anti-seizure effect. And then from there, other pentobarbital type drugs were developed and used around the same time. About 30 years later, there was a publication, a peer-reviewed publication in the Journal of American Medical Association. And this study, or this group, published a study where they screened multiple drugs already in use. And we'll learn a lot more about the drug design process in our next module, actually. So this will kind of lead into that. So this study back in 1938 tested multiple drugs for anti-epileptic activity using different animal models. And so animal models is something we'll also talk about in our next module as well. Shortly thereafter, one of the drugs that was tested was found to be very effective for treating epilepsy and actually became the first major AED for all types of seizures. And we talked about different types of seizures, generalized and more focal seizures. And then in the years to follow, about a span of 40 years or so, different types of anti-epileptic drugs were designed, produced, and utilized. Some for different types of seizures, some for just generalized seizures and epilepsy in general. Okay. So right about the early 1990s is when things started to take a turn. From about 1990 to later, there's now a second generation of anti-epileptic drugs that have been developed. These drugs have better efficacy, fewer toxic effects, which, let's face it, that's what we're looking for. Although we'll see an example towards the end of this. Their toxic effects are still there, still present, still something to be considered. Most individuals who were placed on these anti-epileptic medications and drugs had better tolerability. So even though there were toxic effects, the individuals on these types of drugs tolerated those toxic effects better. And probably one of the most important things is there was no need for blood level monitoring. Previously, the AEDs that were used required blood level monitoring to monitor different levels of all sorts of things in the blood, hormones and other circulating molecules in the blood, to make sure that the drug itself was not disrupting those circulating levels. Some examples of anti-epileptics, second generation anti-epileptics, are shown here. Many of these anti-epileptics are kind of an add-on therapy to be used in conjunction with something else. Those that are starred are exceptions to that. This last one we'll take a look at in further detail a little bit later. So let's talk about the mechanism of action. We know that seizures occur as a result of the electrical activity within the brain being overstimulated, overactivated, right? And so any of these anti-epileptic drugs are trying to find that balance, to bring that back down so that normal communication in the brain can continue to occur. Many of these anti-epileptic drugs touch on different things that are happening in the central nervous system, such as neuronal function, so cell function in general, ion channel function. There's certain anti-epileptics that are specific to specific types of ion channels. We'll see that here in a moment. There is a couple of classes of anti-epileptics that do touch on neurotransmitters. We'll talk about that here in a moment as well. Some affect glial cell function, so those supporting cells within the central nervous system. And they're really all looking to find a balance between the inhibitory and excitatory pathways within the brain to allow the brain to come back to an equilibrium. Other things that can affect the development of a seizure is inflammation. So that's where traumatic brain syndrome comes in, or traumatic brain events come in. They can cause inflammation in and around the brain, and that can then revert back to a link to causing seizures. So that inflammation is a direct link there. All right, so with that, I want to jump into the different types of anti-epileptics. Throwing this out here first, this is, wow, looking at this, it's like, whoa, what am I looking at, right? So we talked over here about all of the different things, all of the different processes within the central nervous system and beyond that can really affect the development of a seizure, and therefore what can be targeted from a drug perspective. And this is putting some of that in a picture, right? So we say inflammation in and around the brain, but what does that look like? Well, a whole bunch of different signaling pathways, some of which are listed here. Okay. I should mention that throughout there's a bunch of different references. I found these references particularly helpful when learning about anti-epileptics and how they work and how they function. So you may want to check those out if you're interested in further reading. So I mentioned that the AEDs target all of those different ways in which a seizure can develop, right? But most of them are going to hone in on the electrical impulses within the cells themselves. And those are your sodium channel and calcium channel blockers. We'll talk about them here in a minute. Then you've got a couple of classes of drugs, anti-epileptic drugs, that touch on neurotransmitter activity, but more specifically, neurotransmitters that are your inhibitory neurotransmitters, like GABA, for example. And so we'll talk about that as well. So let's take a look first at sodium channel blockers. So sodium channels, before we even get to sodium channel blockers, let's talk first about sodium channels. Sodium channels play a huge role in eliciting that action potential within the neuron, okay? They help, the channels help to move the electrical communication down the axon of the nerve cell. And it does this by moving sodium channels from one side of the cell membrane to the other side to allow for a very fast depolarization and repolarization of the cell. Okay, so opening and closing of this channel allows for that. How does it do that? Well, sodium, more specifically sodium ions, are charged. They are positively charged. So by moving them very quickly from one side of the cell to the next, we are changing the charge within that part of the cell, okay? So a sodium channel exists in 3 different states. We've got the resting state, and that's where the channel does allow passage of sodium into the cell, but not at any expedient rate. Then we've got the active state. That's when the channel allows a great influx of sodium into the cell. And then lastly, we have the inactive state where the sodium is actually closed. So there's actually an inactivation gate, which closes the channel, not allowing the passage of sodium ions into the cell. AEDs that tend to target the sodium channels stabilize the inactive state. They don't allow the channels to re-enter the active state. So they kind of keep the channel in the inactive state, not allowing them to enter the not allowing them to enter the active state. What that does is it stops the flow of sodium into the cell, which stops the depolarization of the cell, which then stops the action potential. This then prevents the electrical communication down the axon. Calcium channel blockers function in a similar way. So first of all, let's take a step back and talk what calcium channels are. Calcium channels are, as you can expect, proteins that move calcium from one side of the membrane to the other. Calcium channels are also positively charged. So when calcium channels allow for an influx of calcium into the cell, it helps to initiate that action potential, to start that action potential. It kind of triggers the action potential to start. Calcium channels are known as the pacemakers within the brain, allowing for normal but also rhythmic communication and electrical signaling or activity within the brain. AEDs, and just like in the last slide, I've got them highlighted here in green, that target the calcium channel help to control certain types of seizures, so more focal or pointed types of seizures rather than the general type of seizure. And what they do is they inhibit or slow the flow of calcium into the cell, which then allows for the action potential to be depressed or taken down a notch. Okay, so that electrical activity is being diminished once again. Next, we'll touch on AEDs that enhance the activation or activity of GABA. So remember, GABA is our calming neurotransmitter. It's an inhibitory neurotransmitter. When GABA binds to the GABA receptor, again, a protein, chloride ions, which are negatively charged, move into the cell. Okay, and if we're moving negatively charged ions into the cell, it's going to keep the cell at a more negative membrane potential. When that happens, it's going to be more difficult to initiate the action potential. So this is how GABA works. It is an inhibitory neurotransmitter, and it works by inhibiting or depressing the action potential or the electrical activity within neuronal cells. We can enhance this system of GABA by either enhancing the GABA receptors directly by allowing them to stay open longer, okay, allowing chloride ions to move into the cell for a longer amount of time. We can block the reuptake of GABA. Okay, so some AEDs do that. We can inhibit the metabolism of GABA or the breakdown of GABA. Some AEDs do that. Some AEDs also stimulate the synthesis of GABA. So in all of these 4 different scenarios, what we're effectively doing is the end result of allowing more chloride ions into the cell through the pathway of GABA signaling. Another type of AED that works through neurotransmitters is using glutamate. So a glutamate blocker type of AED is what we're going to talk about now. Glutamate is actually an excitatory neurotransmitter. This is not one that we talked about readily, but it is an excitatory neurotransmitter. So it's going to excite the brain activity. It's going to encourage communication within the brain. When the glutamate receptor binds to glutamate, the neurotransmitter, a cascade of events occurs that eventually activates the action potential. Remember, your action potential is your electrical communication. So if binding to the glutamate receptor causes electrical communication, well, let's stop that, right? Let's block that. So AEDs that act as glutamate blockers do just that. They actually bind to the glutamate receptors and act as an antagonist to glutamate. So these AEDs look similar in size and shape to glutamate, and they fit into the site where glutamate would be binding to the glutamate receptor, acting as an antagonist. But upon binding of these AEDs to the receptor, it does not elicit the same effect that glutamate would. So it's not going to produce that excitatory cascade of events that eventually leads to an action potential or electrical communication. There are a couple other types of AEDs that I want to mention. So there's AED class of drugs that inhibit carbonic anhydrase. If you're interested in reading about them, feel free to click on one of the links that I provided. I think it's the first one, actually, that would allow you to get some more information about that. And then there's other classes of AEDs that really have not a very clear known mechanism of action. Okay? We're actually going to talk about one of those here next. So Keppra, or shown here by its generic name, is a type of AED. It's a second generation AED that was FDA approved in 2000. Okay. It has it's one of those in the class of unknown mechanisms. Although I will tell you a little bit about, I'll share a little bit about its mechanism, at least what we know at this point. So it's quite a favorable AED because it is pretty safe. It has fewer drug interactions, which makes it favorable. Its adverse effects or toxic effects are also minimal in comparison to some other AEDs, but you'll see in a moment that they're still quite extreme. So what we know about the mechanism of action of Keppra is that it actually binds to a protein called synaptic vesicular protein 2A. SV2A, or synaptic vesicular protein 2A, has a major role in secreting neurotransmitters into the synaptic space. So if we can minimize the secretion of neurotransmitters into the synaptic space, then maybe we can inhibit communication. Keep in mind, this type of drug, at least based on the known mechanism of action, and part of it is unknown as well, so we don't know all about this particular type of drug. It acts on the secretion of neurotransmitters, not any particular type of neurotransmitter, just neurotransmitters in general. So excitatory and inhibitory neurotransmitters are being minimized here. Their secretion rate is being minimized. So if we're stopping, let's think about this for a moment. If we are stopping the release of neurotransmitters, regardless of whether they are excitatory or inhibitory, then we're effectively minimizing the communication within the brain. That doesn't mean that we are stopping the electrical stimuli, but it's like the electrical stimuli is going and then there's just a roadblock and the electrical stimuli can't go any further because the SV2A protein is being halted. And when the SV2A protein is being halted, we can't release the neurotransmitters, which is what would happen if the electrical stimuli was allowed to propagate and convert to a chemical stimuli, neurotransmitters, right? Interestingly, this particular drug, Keppra, is rapidly absorbed within the body. It's usually given orally, but it can also be given intravenously. Even orally, moving through the digestive system, it is absorbed pretty readily. And also its availability, bioavailability is quite high. So all of that is a good thing for this particular type of AED. It does have some pretty serious adverse effects, although, as I said, in comparison to other AEDs, these adverse effects are fairly minimal. Okay. I do want to point you in the direction of this particular link down here. This particular link down here is a fantastic link to get you to something called Stat Pearls. Stat Pearls is a great resource to learn about different processes within the body, and also more specifically different drugs that are used for the treatment of different diseases. Okay, so this would be, as you're looking for things, this would be a great link to follow. With that, I've got another couple of resources about anti-epileptic drugs all throughout here. It's where I got most of my information from. All right, and with that, I have nothing else to share. Hopefully you enjoyed part 3 of our foundational principles of the central nervous system and a deep dive into anti-epileptic drugs. Have a fantastic day, everyone.